To help us on this, we are joined by Dr. Gregory Jantz. He's an expert and innovator in the treatment of behavioral disorders. Thanks for joining the show. This is it's a big topic for us. We've been talking about this for some time, but we don't talk enough about the solutions. Let's start with this. Let's level set and talk about where we are with the COVID and how that impacted where all of us who have experienced stress from coming into the pandemic and now coming out of the pandemic.
Right. If we look at the last 2.5, 3 years, it's been a period of chronic, unrelentless, well, we can say stress, but here's what we know right now. Anxiety is the #1 diagnosis, followed by depression. Now, that's a big deal. Anxiety, #1. All forms of anxiety. There is anxiety, depression. Now, here's the third thing we're not talking about, the increase in addictions. Addiction rates are always high when we see anxiety high. So we need to look at what's going on in the area of addiction, but anxiety is at all-time highs. We've never seen it at this level.
Where are we right now? I remember when companies used to send out emails about, oh, we have COVID cases, these people are isolated, and it's just nonstop COVID. And since the pandemic has ended, it seems to have gotten better. Is that correct?
Well, we may have no longer made just the focus COVID, but the anxieties and how people dealt with all that stress, that's remained the same. This is why alcohol consumption, misuse of prescription drugs, and we are still seeing enormous amount of prescriptions being written for anxiety, anti-anxiety medications. So where we are now, we're dealing with the after effects, and I do believe that we're at an epidemic level of mental health issues. And we're really at the tip of the iceberg. Unfortunately, suicide rates have also gone way up. And we're seeing this in our youth as well. 12 to 17-year-olds, suicide is the second leading cause of death. Kids are being affected by this as well.
I know people, and you know people, and I think we all know these individuals who have jobs. And before it was 6, 7, 8 hours a day, and now it's 16, 17, 18 hours a day. And it doesn't matter if they're at the grocery store, they're at home, it's just nonstop, checking the phone, checking messages, it's work. And I have to think that's obviously a byproduct of partly working from home and the COVID, but they can't get out of it. You're stuck because once your boss expects you to respond at 9 o'clock at night, I'm responding 9 o'clock at night, how do we get out of that, break that cycle?
Yes. Well, we need to have what's called time boundaries and parameters, even around social media use. By the way, the more time you spend on social media, you tend to feel worse if you're already depressed. Okay, so we've got, and this is part of the issue that, we went virtual, work from home. Now, honestly, work from home for some did not work well at all. This is where we saw a lot of addiction issues begin. So now we've got to reassign those guardrails of what is our availability. We need to be very careful about that. When we start to disrespect somebody's time, we begin to devalue them actually.
Interesting. So since we have the expert on, I'm going to ask you if you're advising a company on how to better support their employees, whether it's a big company, a small company, or a large company, I think it's just a resource question, but the focus is the same. How do we support the employees?
Well, one of the things is I think we got to be careful about after hours expectations. We all may have a project or something we're working on a period of time, but it can't be like that all the time. The other thing we need to really promote is good self-care. People need to get back and moving. People need to that exercise. We need to go back to really good sleep hygiene. We're seeing more sleep disorders, again, more than ever before. People are anxious, they're waking up during the night, their heart's racing, and they're really having a panic attack in their sleep. So we need to look at how do I get back and create an environment where employees can practice good self-care and actually be more productive and happier.
Yeah, and I'm guessing the first step is probably admitting that you have a problem or an issue with this. Now, okay, so let's talk about the employees. I'm an employee, right? Everybody who works in the studio is an employee, and if I go to my boss, Ahmad, and say, hey, I'm very stressed, I'm very anxious, I'm getting terrible sleep, I'm really struggling at getting my stuff done because I'm so stressed. How do I bring that up to my boss?
Well, one of the things we always want to say, as long as we mean it, is I really want to give you my very best. I am having some struggles. I need some help here so that I can give you my very best. It may be a time struggle. It may be I need more help with something. But I think most supervisors, most bosses really would honor that when they understand we really do want to do our best. We want to feel our best. Happy employees and great teamwork breeds great organizations. Some of us work in a more stressful environment. We probably need to address that and just really acknowledge it.
The last question for you, doctor, is how much is age a factor? I know you mentioned social media, but it's not just the kids having these problems, it's every age group, right?
Here's what we're finding: every age group, and we're seeing more and more men now. I'm at a facility where we treat folks from all over the country for anxiety and depression. We're seeing more and more men, early 50s and above, coming for help. And that's not an age group that normally we would be seeing, but there's a real increase. And there's a real increase in those seeking help for anxiety and some significant anxiety with physical complications.
Doctor, we are grateful for your time and certainly appreciative, and we will certainly ask for you to come back again to help us in the
Good.
months to come. This is just the beginning of our conversation. Thank
It
you.
is. Good. Thank you.